Good evening, everyone. I am Soumya Kumar, a third year student from Shamsha Medical College, Riva. So, this will be my third video regarding medicine, and the topic for today is pulse. So, today I will be covering 5 topics within pulse. So, they are as follows: definition, site of palpation of pulse, the normal pulse waveform and the components of pulse, the basics of BP, and abnormal pulse. So, what is pulse? So it is a rhythmic movement that is felt in an artery when blood flows through it. Now blood will flow through an artery only when the heart pumps it. Now what are the inferences that we can have about pulse? Like first is the heart rate. Like now the normal pulse rate is or heart rate is 60 to 100 per minute. If it is less than 60 per minute, it is bradycardia. If it is more than 100 per minute, it is tachycardia. Now we must have learnt about relative bradycardia as well. Now what is relative bradycardia? So like in cases of fever, as the temperature rises, the heart rate will rise proportionally. Like when the temperature rises by 1 degree Fahrenheit, the 10 beats will increase per minute. So this is the normal case. But in case of relative bradycardia, instead of 10 beats per minute, there may be a rise of only something like 6 beats or 7 beats, but less than the normal. So you can say it as a condition of a fever in which the heart rate is increasing but not to the extent that is expected. So it is seen generally in conditions like typhoid. Now we will see about the rhythm of pulse. Based on timing between the heartbeats, pulse can be regular or irregular. Regular pulse is referred as sinus. Like you must have heard about sinus bradycardia. It means a kind of regular bradycardia or normal bradycardia. And we have irregular rhythm of heartbeat. So irregular means no, it is not regular. Arrhythmia also means the same. Like without rhythm, arrhythmia, like that. Since I don't have any access of a patient right now, so I will be showing it by a practical example. Like as you can see, this is the table, these are my hands. Now suppose the pulse is like here. You can see at every regular interval of time the same number of beats are taking place. So this is regular. Now we go to irregular. So here you can see in the same or maybe different interval of time, the number of beats are different. So similarly you can say the beats can be irregularly irregular, irregularly irregular, or regularly irregular, something like that. So now we will be seeing the second subtopic for today, that is the site where we can palpate pulse. Now pulse can be palpated on the radial artery, femoral artery, dorsalis pedis artery, posterior tibial, subclavian, brachial, ulnar, popliteal, etc. Now radial artery is most commonly used in any patient because it is easy to access. Now the normal pulse waveform. As you can see here, this is the normal pulse waveform. So first it is undergoing an increase, a peak, a notch, and then a slight increase again and then decrease. So here there are different parts. The notch basically signifies the S2 heart sound. What is the S2 heart sound? It happens due to the closure. It is a second heart sound. It happens due to closure of the aortic valve. Now the different components. Now component number 1, the percussion wave. Component number 2, anacrotic notch. Component number 3, the tidal wave. And component 4, the dicrotic notch. So as what is percussion wave? Percussion wave happens due to entry of blood into the aorta or the artery. Then tidal wave happens due to the recoil. As the blood leaves the blood vessel, there is a recoil that takes place from the walls of the vessel. Like for percussion wave, we can say like this is this red part is the wall of the blood vessel. So as blood flows through it, it will exert a pressure on the wall. But similarly, when blood leaves through it, the wall will exert an equal pressure. Like you must have heard about the third Newton's law. It basically is an application of the same. Now anacrotic notch basically is a point from where the pulse undergoes a further increase, and dicrotic notch is basically the demarcation of systole and diastole. Now we have two peaks. In systole there is one peak, and in diastole there is one peak. And so the peak is based on the systolic pressure depending on the stroke volume. Now the fourth subtopic of today, the basics of BP. Now you must have known that in BP we have two components mainly, systolic and diastolic. Now according to the American Heart Association, the normal blood pressure systolic is less than 120 and for diastolic it is less than 80. Now why are we adhering to the AHA guidelines? Because AHA is responsible for guidelines of various conditions, like suppose there is a hypertensive emergency, then we use the AHA guidelines to counter it. Like suppose there is a 55-year-old person, we have to counter it, then we will give 55-year-old person with hypertension. So as to counter it, we will give calcium blockers like amlodipine and so on. Now because these organizations give guidelines, we follow them. There are various other organizations like American Academy of Pediatrics. Now what is the systolic BP? So as the blood flows across the artery wall, the force that the artery will face, it is the systolic BP. Now what is diastolic blood pressure? BP in the arteries when heart rests is diastolic blood pressure. Now what is pulse pressure? It is a difference of the systolic and diastolic pressure. Systolic pressure is always more than diastolic. So as you can see, in the normal 120 by 80, the pulse pressure will come as 40. But we generally keep a range because humans are imperfect and variations are bound to occur. So pulse pressure is taken as 40 to 60 mm of Hg. Now if it is more than 60, like suppose a pulse pressure of 80 mm Hg, it is seen in aortic regurgitation and hyperthyroidism. And for a narrow pulse pressure, like suppose 30 or 20, like in case of a blood pressure of 110 by 90. So here the pulse pressure is very less, only 20 mm Hg. So it can be seen in conditions like aortic stenosis or hypothyroidism. Now there is another aspect, that is the mean arterial blood pressure. It is diastolic blood pressure plus 1/3 of pulse pressure. So as we know, the normal diastolic pressure is 80 mm Hg and the normal pulse pressure is 40 mm Hg. So 40 by 3 is 13.3, and so the normal mean arterial blood pressure will come out as 93.33 mm Hg. Now the pulse deficit. What is pulse deficit? So we know that for any kind of examination, general examination, we have four methods: inspection, palpation, percussion and auscultation. Now for examination of the heart, we generally take two things, that are palpation and auscultation, like for pulse basically. So in pulse deficit, we are taking the heart rate by auscultation minus the pulse rate by palpation. So generally it will come less than 10 per minute. But if the pulse deficit is more than 10, it will be a condition like atrial fibrillation. Now what is atrial fibrillation? Again, it is a kind of arrhythmia. It happens when the atria is unable to fill properly. So that because of the high rate of beating, like beating of the heart. So that is why the heart rate will be very large, and so pulse deficit will be less. Now the normal pulse is referred to as a catacrotic pulse. Now the different type of abnormal pulses. Now this is the normal pulse waveform, and now we will discuss about the abnormalities of pulse and the examples. The first one is pulsus parvus. So parvus generally means lower. So in pulsus parvus, the peak of pulse decreases, as you can see here. This is the normal. With the blue pen one is the normal, and the one made with red is abnormal. So the peak has decreased. Now when can we say there is pulsus parvus? In cardiogenic shock. Why? Because in cardiogenic shock there is a circulatory failure, blood volume decreases. So that is why the intensity, now the peak is based on stroke volume. In cardiogenic shock, the stroke volume itself will decrease. So that is why the peak will decrease. So it is pulsus parvus. Then we go to pulsus et tardus. So you must have heard about tardive dyskinesia. Now what is tardive? Tardive means delayed in any condition. So pulsus et tardus means a delayed pulse. So generally it means the peak will be the same, but the peak will arrive late. So this is left. This can be seen in left bundle branch block. Now what explains it? So in left bundle branch block, due to the so in left bundle branch block, the innervation from the left side, bundle branches is blocked. So that is why the innervation will decrease. So only the right side will give an innervation and the signals to beat for the heart. So that is why the heartbeat will delay, and so the pulse is also delayed. Then we go to pulsus parvus et tardus. Here the pulse is delayed as well as the peak is reduced. So this is seen in aortic stenosis. Now I will cover these conditions like aortic stenosis, regurgitation and all in other videos. But for short, aortic stenosis is a condition in which the opening of the valves is reduced in size. So there will be a decreased in the blood flow through them, like through the aortic valve from the left ventricle into the aorta. Now this is my favorite pulse. The next one, Corrigan pulse or water hammer pulse. So it happens in condition having a wide pulse pressure like aortic regurgitation or hyperthyroidism. So what is this? It is a condition where the pulse rises rapidly and also falls rapidly, as you can see by the red color over here. Now this question came in a pathology quiz of AIMS as well, basically. Then we go to next one, pulsus disferiens or bifid pulse. Now normally, as I have discussed, in systole we have only one peak, in diastole we have one peak, and the systole and diastole are demarcated by the dicrotic notch. But when there are two peaks in the systole itself, this condition is bifid pulse. So it happens in hypertrophic obstructive cardiomyopathy. The next one is pulsus alternans. So it is a condition in which the peak, like each pulse has a different waveform. Like the peak of every pulse is different, as you can see over here. So it happens in fibrillation of the left ventricle. And next is pulsus paradoxus. So it happens when during inspiration the peak decreases by 10 mmHg or more. As you can see over here, there is a decrease in the pulse during inspiration. This happens in conditions like COPD, that is chronic obstructive pulmonary disease. A thing I forgot to mention is telling about the Corrigan sign. Now, like we have read about the Corrigan pulse or water hammer pulse, in which there is a rapid rise, rapid fall of the pulse. But there is a Corrigan sign as well in aortic regurgitation only, in which so what does Corrigan sign mean? Like a visible pulsation of carotid or supraclavicular artery is Corrigan sign. So aortic regurgitation has many such signs like the Landolfi sign, Alfred de Musset sign and all, which I will be teaching in the video of the same. So thank you, bye. So yeah, this was my third video and I am still learning medicine. So if you like, you can like and subscribe. Thanks.